there's a lot of stress and a lot of pressure going on right now. And I know that stress and pressure compromises our immune system. It makes us more vulnerable to contracting an infection, and it can cause so much heartbreak if we don't deal with our mental health. And so I just want to be talking about that to people. And Vanessa is a great example of that. She's joining us from Washington, and her 90-year-old mother, Fiona, currently lives at the Kirkland Life Care Center in Washington, which has just been plagued with coronavirus related deaths. You've heard about this nursing home up in Washington. This is the nursing home that everybody's been hearing about, and her mother is stuck there. She's elderly, she's in the highest risk group, and she has contracted the virus. And Vanessa, thank you for being here, and I'm so sorry for your situation. And you've had hell just getting information, right?
Oh, definitely. And I want to thank you for having me, Dr. Phil. I really respect you. It's been a tough road.
Well, I can't imagine. And shame on the system, whatever it where it broke down, for you not being able to find out about your mother when all this started happening. I hate
It,
that for you.
yeah, I appreciate that. It from the get-go, there was no communication. Um, Nobody knew what was happening to their loved ones. And it's just the worst fear not knowing. And when you see people being taken away in ambulances, is it your mom? Is she dead? Is she alive? Is it your father? None of us knew, all the families.
Well, when you break that system down, there are good people behind it, and I'm sure they're overwhelmed with the chaos and stuff at the same time. So I've seen that happen in crises, tornadoes, hurricanes. Good people get overwhelmed with bad situations. Have you talked to your mother?
I have. Finally, when the CDC took over, they had nurses and doctors in the life care center, and they have been calling me daily, checking in with me. So it's finally had a positive turnaround, thank God.
Yeah,
But she's doing worse. So
yeah. And how long has she had the virus at this point?
2 weeks
Yeah, so she's 14 days into it. And is she going up or down? Is it getting
down.
down? Mm-hmm.
Yeah, her heart it has been giving out,
Mm-hmm.
and they just started giving her morphine a couple days ago.
Yeah,
Spoke with her last night, and I can tell it's in her throat. I have a sinus infection right now, but
yeah.
her voice sounds like mine because of the sickness. So,
Well, as you know, I've lost both of my parents, and it's never easy, no matter how much we expect it coming. But I I know that the thing that has helped me when I lost both of my parents was focusing on what I did have with them. And
mm-hmm.
you've had her for decade after decade after decade, and it's so important that we focus on the process of their life instead of the event of their death. And you know that she's high risk, being 90 anyway, and
Yeah,
she's had a long life. And will coronavirus be what gets her? You don't know. Will it be that, or will it be something else? We reached out to Kirkland Life Care Center and sent the following response. Our most heartfelt sympathies go out to all the families. It should be remembered that this event also happened to us. In the first few days of the outbreak, our facility lost a third of our staff, and to date, 55 employees have tested positive for COVID-19. In the first few days of the outbreak, we were doing everything we could to keep ahead of the medical needs of our residents, but unfortunately, our ability to reach out to all family members was diminished. 2 weeks later, we're still in the middle of this crisis, and we still have many employees who are out sick, but we're starting to return to a level of normal staffing and to a normal level of care, and our ability to respond to families has improved over the past week. So it's kind of like I'm saying, they get overwhelmed when these things start, but
oh,
they're
definitely.
they're good people, and I suspect they've taken good care of your mother over time.
Oh, definitely. I've known moms, the people that bathe her and bring her tea and her lunch, and they work very hard for little money,
Yeah.
and they're amazing people.